Okay. Ashley, are we good?
It is still loading for some reason.
Okay.
Okay,
Um,
we're good. We're good.
okay. All right. Thank you all. Okay. Good afternoon. I'd like to call this meeting of the Committee on Health to order. Today is Thursday, July 11th, 2024. The time is 3:16 p.m. Apologies for beginning late. We were just wrapping up a hearing. This is an additional meeting of the Committee on Health, and due to the street closures this week around the Wilson Building, we are holding this meeting virtually. I'm at-large Councilmember Christina Henderson, Chair of the committee. We have been joined by Councilmember Zachary Parker from Ward 5, Councilmember Brianna Doe from Ward 1, and Councilmember Charles Allen from Ward 6. This is a quorum of the committee. Today, we will be considering and voting on several measures before the committee, including 7 confirmations and one bill, Bill 25-565, the Certified Nurse Aid Amendment Act of 2024. If there's no objection, I'm going to move all of the nominations in block. All right. Okay. I don't see any objection. Okay, so first, for the Board of Social Work, we will have one nomination. The Board of Social Work regulates the practice of social work in DC, including specialties within the profession. The board includes 5 members: a licensed independent social worker, a licensed independent clinical social worker, a licensed graduate social worker, a licensed social work associate, and a consumer member. PR 25-807 nominates Wanda Wheeler for reappointment as an independent clinical social worker for a term to end March 3rd, 2027. Ms. Wheeler is a licensed independent clinical social worker with extensive experience running private psychotherapy practice in Washington, D.C. for nearly 15 years. She holds her Master's of Social Work from New York University. Additionally, Ms. Wheeler has worked at the National Institutes of Health in various capacities, managing programs and budgets and improving customer satisfaction. She is a Ward 4 resident. PR 25-808 nominates Celeria Moore for reappointment as a consumer member for the Board of Social Work for a term to end March 3rd, 2026. Ms. Moore is an adjunct professor at Trinity Washington University and a retired DCPS early childhood educator. She's also a community advocate with 40 years of professional and personal service. She holds a master's in child development from Texas Southern University, and she is a Ward 4 resident. We have one nomination to the Board of Pharmacy, which regulates the practice of pharmacy and the practice of pharmaceutical detailing in the district. The board evaluates applicants' qualifications, recommends standards and procedures, issues licenses, and receives and reviews complaints. The board also administers the examination for a range of laboratory professionals who prepare, study, and process patient tissue and cell specimens. PR 25-826 nominates Roderick McGill for appointment as a consumer member to the Board of Pharmacy for a term to end March 12th, 2027. Currently, Mr. McGill serves as an Assistant General Counsel with the Department of Defense Legal Services Agency, Defense Human Resources Activity. Additionally, he serves as a mediator with the District of Columbia Superior Court, multi-door dispute resolution, where he develops and implements conflict resolution strategies and drafts legally binding agreements for landlords and tenants. Mr. McGill earned his Juris Doctorate degree from the University of the District of Columbia, and he is a Ward 8 resident. We have one nomination to the Board of Dietetics and Nutrition. The board is comprised of 5 members appointed by the mayor, including 4 licensed dietitians and licensed nutritionists, with 1 consumer member. PR 25-831 nominates Emily Arkin for appointment as a dietitian licensed in the District of Columbia for a term to end March 12th, 2025. Ms. Arkin is a registered dietitian nutritionist based in the district, and her group practice specializes in eating disorders and medical nutrition therapy for gastrointestinal disorders and other illnesses across life stages. She earned her Master's of Science in Nutrition and Public Health at Columbia University, and she is a Ward 4 resident. We have one nomination to the Board of Medicine, which regulates the practice of physicians, physician assistants, anesthesiologist assistants, surgical assistants, physicians in training, trauma technologists, doulas, and professional midwives. PR 25-837 nominates Dr. Andrea Anderson for reappointment on the Board of Medicine for a term to end August 3rd, 2026. Dr. Anderson is a family physician and has served as the assistant medical director at the Upper Cardozo Health Center for 16 years, where she coordinates policy and curricula for over 80 family physicians, nurse practitioners, and physician assistants. She also serves as the medical director for Reach Out and Read Metro DC, a nonprofit organization working directly with pediatric providers to promote early literacy among children. Dr. Anderson earned her Doctor of Medicine degree from Brown University, and she is a Ward 5 resident. And then in terms of the Board of Dentistry, we have two nominations. PR 25-840 nominates Dr. Eric Bradshaw to the Board of Dentistry for an appointment to end November 30th, 2026. Dr. Bradshaw is a general dentist with advanced training in implant dentistry, cosmetic dentistry, and Invisalign. Dr. Bradshaw operates his private dental practice, Mint Dental, in the district. He earned his doctorate of dental surgery from Howard University and is a Ward 4 resident. And PR 25-841 nominates Dr. Janelle Animalechi to the Board of Dentistry for an appointment to end with a term of November 30th, 2027. Dr. Animalechi is a board-certified pediatric dentist and the CEO of Children's Choice Pediatric Dentistry and Orthodontics. She earned her doctorate of dental surgery from the University of North Carolina, and she is a Ward 5 resident. I will now open the floor for any discussion on these nominees. All right. Hearing none, I now move the draft reports and prints in block with leave for staff to make any technical changes. All in favor, please say aye.
Aye.
All right. Let the record reflect that that was unanimous. Okay, we'll now move on to our one piece of legislation, which is Bill 25-565, the Certified Nurse Aid Amendment Act of 2024. Just for folks who are keeping track, that was originally introduced under a different name. It was originally introduced under the Direct Care Worker Amendment Act of 2023. I introduced this legislation along with council members Allen, Fruman, Lewis George, Nadeau, Parker, Pinto, and Trayon White. The intended purpose of this bill, as introduced, was to address the district's current direct care worker challenge. DC reports that as of June of 2024, the District of Columbia has 3,067 certified nurse assistants registered, 7,459 home health aides registered, and about 1,000 of these individuals who are duly registered. The most recent DC Health Workforce Survey showed that there was an 18% decrease in the number of nursing assistant personnel in the district between 2020 and 2024. Specifically, certified home health aides in the district decreased by 13%, and certified CNAs in the district decreased by 28%. Advocates ascribe the shortage to low pay as well as high administrative burdens. There are approximately 36,000 residents in the district who need direct care, and with the aging population continuing to grow, that number will only increase. So it's critical that we work to address this issue. The committee held a hearing on this bill on March 13th, 2024, where we heard from members of the public, the Department of Health, as well as the Department of Healthcare Finance. Since then, the committee has conducted extensive research and met many times with agencies and stakeholders to make improvements to the bill. I'm very proud of the committee print that we are considering today and the ways in which it will address the direct care worker crisis here in the District of Columbia in significant ways. First, I'm going to talk about the committee print. The bill eliminates the barriers to licensure and certification by combining the certified nurse aide and the home health aide license into a unified license. Certified nurse aides and home health aides provide crucial care and support services to patients under the supervision of a licensed nurse or other medical professional. Their responsibilities cover a wide range of activities important to the daily life of a patient, including monitoring vital signs, cleaning medical supplies, communicating with a patient's concerns to the medical provider, aiding with nutrition, hydration, and more. Under the previous regulatory system for certifying CNAs and HHAs, providers perform essentially the same functions, but in different settings. CNAs generally perform services in skilled nursing facilities or other facility settings, while home health aides provide services in a patient's home. Through a DC health emergency regulation intended to help the strain on this particular workforce, CNAs can now work in a home setting as well. However, an HHA can still not provide services in a facility unless they are also certified as a CNA. The workforce shortage is dire, and the burden to maintain two different certifications has added an additional strain. Further, because the qualifications are slightly different, professionals often must take time off of work to complete an additional course in order to become certified as the other provider type when the majority of the trainings happen on the job. This is an undue burden on an entry-level position with generally low wages. The committee print differs from the bill as introduced, which had previously created a unified direct care worker license. However, DC Health testified that the term direct care worker is not universally acknowledged or transferable to another state. Therefore, the committee print changed the combined license name to a unified certified nurse aide license and renamed the bill as such to more appropriately describe the workforce affected by this bill. Another issue that we took up was increasing the workforce with Maryland and Virginia CNAs. The committee print takes a different approach from the bill as introduced regarding incentives for CNAs and HHAs from Maryland and Virginia to practice in the district. Although the bill allowed reciprocity for these workers, many advocates were supportive of reciprocity. DC Health strongly urged the committee against blanket reciprocity, primarily out of concern for patient safety, especially considering Virginia does not require criminal background checks. DC Health cited a considerable number of complaints for unprofessional conduct for CNAs and HHAs, including sexual misconduct and abuse, and reciprocity would not allow for DC Health to have oversight over Maryland or Virginia professionals. Further, Maryland and Virginia would not be able to discipline these individuals because of alleged misconduct that occurred outside of their jurisdictions. The committee print instead creates an expedited temporary license for CNAs and Maryland and Virginia in good standing, which would allow them to work in the district within 5 business days, while DC Health fully processes that application. This will allow for the individual to begin working much sooner than the traditional licensing process. DC Health has assured the committee that this would be feasible to implement by November of 2024 and would not have an additional cost. Again, would not have an additional cost. The Committee on Health is committed to following the status of this expedited temporary license and to reevaluate its effectiveness in early 2025. If it is not working as expected, the committee will consider new requirements for the FY26 budget process. Another issue that we raised, the committee updated print also establishes an advisory committee on CNAs and nursing assistant personnel composed of workforce, employer, and training program representatives to propose recommendations to the Board of Nursing to help develop new credentials and standards of education for the new CNA license. This advisory committee was born out of concern shared with the committee that the lack of CNA and HHA worker and employer representation on the current Board of Nursing. The advisory committee will sunset after 2 years with the understanding that they will work with the Board of Nursing to develop a new standards and curriculum in that timeframe. Finally, the committee heard feedback around the language in the bill as introduced, increasing the minimum living wage for direct care workers to 120%. Advocates expressed concern that this language would indicate to the Department of Healthcare Finance that 120% was a flat rate and a ceiling rather than the floor. Department of Healthcare Finance confirmed this interpretation in their testimony, and therefore the committee print is updated to reflect changes to ensure that 120% is implemented as an average floor. And so the tier payment system can be maintained. This, in terms of the fiscal impact statement, I do want to underscore for the record that this bill has 2 components: the Unified License and Advisory Board and the wage increase. The OCFO's fiscal impact statement states that DC Health can implement the Unified License and Advisory Board with no additional fund costs. However, the wage increase is now at an estimate cost of approximately $8.7 million in local Medicaid dollars. Therefore, the bill includes an applicability section to ensure that DC Health can begin the process for unifying the license and begin issuing temporary licenses separate from the increased wages. And we recognize the urgency of starting this process as soon as possible. With that, I'd like to open the floor for any discussion on this legislation. Of course, none of my colleagues want to give me a moment to get some water. Okay. All right. I now move the committee print and accompanying committee report with leave for staff to make any technical forming changes. All in favor, please say aye.
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 All right, let the record reflect that this measure passed unanimously. Whew. This concludes today's committee meeting. Please note that the council will go on recess starting on July 15th through September 15, 2024. During this period, committees cannot hold hearings or meetings. And so once we are back from recess, the committee intends to hold several other hearings and markups before the end of the council period in December of 2024. We will post those hearings on the hearing management system as soon as those are finalized. But for right now, I want to thank all of my committee members. I want to thank all of my staff for their incredible work so far this year. And the time is now 3:30 p.m. and this meeting is adjourned. Thank you all so much.